You are listening to BitsCast KE, conversations that matter to young people, bit by bit.
Mazungumzo ya kweli na jamii, uwezo kwa vijana, mabadiliko. Mazungumzo ya kweli na jamii, uwezo kwa vijana, mabadiliko.
Welcome back to BitsCast KE, conversations that matter to young people. On this episode 7, we'll be talking about intersectionality between HIV, AIDS, and the queer community. Discrimination, stigma, and limited access to healthcare services make the intersectionality between HIV and the queer community in Kenya a compelling and also a complex and challenging issue. In this episode, we will delve into the intricate relationship between two words, uncover crucial solution, and provide essential guidance for the queer community individuals in need of this support. My name is Alex Oburu, and I'm joined by Ruele Okeyo. Ruele, habari yako?
Mzuri sana.
How are you feeling?
And introduced by the recovery that sounds so official. What a jokes.
Yeah, probably. So thank you so much for coming, and also agreeing to have this conversation. I feel it's timely, and also we need to talk about these things.
Yeah, but let's not call it timely. I mean, it's not timely. It's needed.
It's needed. It's needed.
Exactly.
So before we even start, will you introduce yourself? Because you said it's nice if you introduce yourself.
Yeah. Well, my name is Ruele Okeyo. I am a SRHR, that is a sexual reproductive health rights advocate. I am a director at Kenneth and Jacob's House, which is a shelter for homeless and runaway queer youth, and a HIV champion. So I work with Prevention Access as U equals to U ambassador for Africa in Kenya. In the Prevention Access campaign. And aside from that, I also am a content creator, majoring my content mostly on HIV and human rights for everyone.
What? Where?
Yeah, that's just it. Yeah.
Everything that you're doing, do you get free time to maybe just relax?
I live my best life.
How do you balance?
I live my best life. I schedule everything and do everything in one day. And I have 6 days to live my best life. Yes.
So you only work for a day?
I only work for a day.
What?
And that's it. I only work for a day.
The rest of us work for 6 days.
Yeah, unless I have something pressing that needs me to be out of town, then, having a meeting somewhere. But aside from that, I schedule and plan myself and make sure I execute everything in a span of 1 day. And then that's it. Live my best life. That's why I'm here today.
I think after this podcast, I have to be you need to share some secrets.
The secret is, getting things and people to work for you. So arrange yourself really well, plan yourself really well, get people who are able to help you out. And you have your 6 days of rest.
Amazing. So as we get started with this conversation, I just wanted us to set grounds in one of the best and very simple questions. Yeah. What is exactly HIV before we even jump into the intersectionality?
Virusi.
Yes, it's because it's very simple.
HIV, I'm just going to go back to the basics. That is human immunodeficiency virus. So I don't want to talk about it in a scientific way, considering our audience is not. But let's just say once you have HIV, you'll be taking pills for the rest of your life until there is a cure. But for now, we're taking pills for the rest of our lives. It's a virus that affects the immune system and prone to getting, some, should I call them opportunistic diseases? Yeah, let me call them opportunistic diseases. If you want to know what that is, do your research. We're only giving you 90%. The 10% is yours.
Yeah. So do we have some challenges that people who have HIV AIDS face? And do we have solutions?
Yeah, we do. And mostly it has to start with us as people living with HIV, because I forgot to mention, but I'm a person who's been living with HIV for 3 years now. I've been saying 3 years for a long time. It seems to be longer. So September 2020, 26, and now in 2020, that's 3 years, right? I think so. Yeah. So I guess one of the major challenges has to be stigma. And before even stigma has to stem from other people, it stems from us. we stigmatize ourselves to a point that we refuse to have our lives move on. You see, that's a very, very huge challenge. And I'm really sorry to say this, but this is going to be so hard. The people living with HIV tend to always, want to be the center of, I can't do this because I'm HIV positive. I'm afraid of doing this because I'm HIV positive. You have to base your entire life around being HIV positive. You see? And that is one of the ways that is destroying even our social lives, because we're afraid to date. We're afraid to be in relationships. We're afraid to look for employment, because at the end of the day, we're afraid that once I find out about my HIV status, I'm not going to get this. I'm not going to get them. So one of the ways we can be able to solve that is by slowly accepting ourselves. I know this is something that I'm also not against when I say accepting ourselves, because acceptance is a long process. It just doesn't happen overnight. It takes time, but that's something that we need to work on first before we can allow to let other people in. Because one of the things I have faced is that the most important question people living with HIV tend to ask is, will I be able to be in a relationship again? But how can you be in a relationship with someone? How do you want someone to accept you when you haven't accepted yourself yet? So first is to work on me, to work on myself. Make sure that I'm in a position where HIV is not something that is a determinant factor in a relationship or in job application. If I have to be with someone, HIV is not going to be a topic of discussion. I'm going to tell you I'm HIV positive. And if you are not up for that, then take up your things and leave. If you're up for that, then let's move forward, right? So be in a position where you're very strong and very courageous, that if anyone says no to you because of your HIV status, it doesn't affect you in any way. It doesn't affect you taking medication. It doesn't affect you going back to the clinic for checkups, right? So that is one of the challenge. And now it has to start with self-stigma. Now we have to go to external stigma, right? This is a challenge, right? We find that when it comes to society, you can't change society's perceptions. True. Everyone has their own thinking capacity, and you can't take that away from them. Everyone has an opinion. If I have the latest iPhone, they're going to say it's not the storage, right? If I have an Android, they say don't have an iPhone. If I have a Demio, they say don't have a range. I mean, it's a car. It's going to get me from point A to point B. Everyone has an opinion. So even when it comes to people living with HIV, I think it's really, really best. This has worked for me, is by shutting that out. Is by literally, as long as the immediate, most important people in my circle are okay, then I don't care what any other person in the society has to say about it, because you're not directly linked into my life, right? So, and we have to tackle the individual, we've tackled the social, but now when it comes to, the political, and we need the government to start investing in HIV. Because we have the government, we are I think at a point we're relying on 90%, if not 98% reliance on donor funding. What happens when donor funding goes, right? We need government to start investing in HIV locally, right? Because too much dependence on something that, we're dependent on someone else, we get free ARVs. If it now comes to it, we're going to have to start paying for ARVs. And that is a cost that not so many people are ready to take. If you go to the chemist itself, I think PEP, if I'm not wrong, PEP is like 3,000 Kenyan shillings. And that's just PEP. So what about HIV? What about ARV drugs? No one has 3,000 every single month to be buying, medication. So how can we as a Kenyan government be able to utilize the funds, the resources that we have? Let's utilize the taxes, man. That's the way we can be able to. If I have to pay so much tax, the taxes are too high, I want to walk into a health facility and get medication. I will. I can go on. So
I love how you've connected everything from stigma to both internally and also externally to what the government is supposed to be doing. Now we have set like a really good ground in terms of like HIV. Now going to the next part of, of the episode, which we are talking about intersectionality between HIV/AIDS and the queer community.
Yeah.
And you have worked with the queer community for quite some time also.
I am a queer person. What you talking?
You have worked with them also. Now, beginning with defining exactly like who is a queer person, number one, and what is the intersectionality between HIV/AIDS and a queer person.
Is it really important of understanding who a queer person is?
We're just setting base. Our audience, most of them don't even have this conversation.
Yeah.
So we are relying on podcasts like this to
Yeah.
give, informed opinions. Yeah, so they can be able to make like also informed decisions from their end.
Well, just the term queer itself, it's very diverse and it's very broad. But if we have to talk about queers, then that has to go down to sexual orientation, gender identity, and expression, right?
Using the simplest way. The simplest way.
Damn.
Yeah.
The simplest way to define a queer person. Ish. Can I curse? No, I can't.
No, you can't.
Yeah, well, I'm trying to find a simple way. If I have to talk about sexual orientation, gender identity, here I'm talking about the gays, the lesbians, the transgender, the intersex community. We have the two spirits, the androgynous. So to encompass all that, we just use the term queer, right? So it's literally the LGBTIQ community that encompasses the term queer. So the intersectionality between queer people and HIV. Yeah, we have to talk about the disparities that happen when it comes to health rights. Because for someone who is, let me use the flamboyant gay man and the masculine lesbian stud. Trying to access public health facilities is a challenge. Because it's going to get to a point where you're not focusing on giving me services, you're focusing on how I look, how I present. So it's going to be hush tones. And, this is something that has been said time and time again, which looks like it's a joke, but it's not, right? Not everyone is able to access a community facility that can be able to offer these services. We can't be able to access services because once I walk into a health facility and I have my nails painted, or I have, I'm very flamboyant in my presentation or my expression, that already is question for, hush tones between the medical practitioners. Not all facilities, but most of the facilities that are accessible, right? This is something that caters to that. So if I'm a man and masculine presenting, right? And yeah, I go to a facility and I have to tell the doctor that I have anal warts. Yeah, the first question is, how did you get them, right?
Yeah.
I'm not about to go tell them like I took it up like a man. That's not a conversation I'm going to have with my doctor, right? So because already the stigmatizing effect that comes from that, because you already know like, you get anal warts from having anal sex. But now if that comes out, again, it presents that nature of disassociation. You don't want to work or you don't want to provide the right services. You now start questioning my lifestyle choice, my life choices. Like, as a man, why are you having anal sex? Why are you, doing this? It's not right. So now it becomes a sermon. It doesn't become providing the services that I need. Right. So you find that most people would tend not to seek services.
Yeah.
And the facilities that exist that offer services to queer people are not so many. And then, the distance, people have to use like 2, maybe 3 matatus. And that's just one way, So if I have to sit and think, am I going to use 2 or 3 matatus to a facility? I could use this money to buy food, the economical challenges that we're facing right now, if most people have to choose between food and going to the clinic, if it's not that serious, I'm going to choose food because, this can wait, right?
Yeah.
So you find that most queer people would not be able to seek services because they already feel judged by just their their gender identity and expression. For transgender people, it's even hard for them to access facilities because when you look at me, you're seeing a woman, but my identification card reads, Okeyo, Ruel, make it make sense.
Yeah.
It's not going to be right, okay? I'm not going to be able to access a facility because one of the things you asked for when you're going is, when you're registering, the identification cards. And then they provide the medical card, right? So for a transgender person, it's going to be really hard distinguishing the two, like the person you identify with and what's in your identification card. So, access to these services becomes a really, really huge challenge.
Yeah. And what is coming out clearly from this conversation is the fact that there's a lot of stigma that we really need to deal with.
Yeah.
Now, from your experience as a queer person, one of the biggest challenges is people are scared to maybe access this youth-friendly services from these clinics, from this hospital, because maybe, transport and all that.
Yeah.
How have you been able to maneuver this challenge from your end now?
I'm a thick-skinned one.
Having a thick skin.
I am a thick skin. But, it all comes down to... Damn, this is a really long story. Just go listen to my podcast and then you'll understand it better.
Give us tips.
How I have been able to manage, and overcome all these things is I decided to work on myself. I decided that, I am a person living with HIV. So, one, my immunity is already compromised. I can't, and I got HIV at a point in my life when I could not be able to, afford. I was jobless, I was homeless, I was really, really broke. So there was no way I could be able to fall sick just because I wanted to fall sick. So having that in mind, like I can't add more expenses in my life. That's how I started to work on myself, by just taking the ARV medication, right? So understanding that I needed to get my health in check because my health is my priority. That's what I needed to as much as it was hard, I needed to go to the health facility. I guess it stems from within. It's a me thing. It's not a we thing. You might be there to support me, but at the end of the day, it's me. If I don't take my meds, I fall sick. As in, you might give me all the inspiration that you need. I might be giving you inspiration to who's listening, all the inspiration you need. But at the end of the day, it's just you to decide to take your health into your hands. So that will mean you'll have to go to the clinic. You'll have to take the medication. You'll have to do the tests that need to be done. So it's all amounting to you as a person and how you want to come out of this. Do you want to become the victim or do you want to become the victor?
Yeah.
So,
very well said.
Yeah.
You have to become the person who takes care of yourself and prioritize yourself.
Exactly. It's a you thing. It's not a we thing. We're just here to offer support.
Now, what I'm asking is basically, to what point did it get to you that you're supposed to be able to take care of yourself? You're supposed to be taking medication, maybe working out, maybe, continuing to enjoy life as a normal person and not letting this...
Well, define normal person.
Basically, continue to live as someone who is not...
Well, also people with HIV are normal.
Someone who is not pushed back with, the fact that you're sick or you're dealing with something. Yeah. Just letting free and living.
Yeah, I mean, there is no option, man. I was broke. I was seriously broke at that time when I tested positive for HIV. I could not add any other expense. That's where it stemmed from. I knew I needed to take my health seriously because, if you don't take your every meds, you're going to get hit by so many things. There's TB, there's malaria, there's herpes zoster, there is, pneumonia. All these things could be able to attack you at any given time. I don't have money to go to the hospital to start treating HIV, to start treating malaria or pneumonia or, all of those opportunistic diseases. It stemmed from me being broke and not being able to afford healthcare that pushed me to take my every medications to a point where, before acceptance came, that was my driving force. I was too broke to afford healthcare. So that's why I kept on taking it, because I didn't want to add any other thing to the list of tragedy that was tagging
along. This seems like a bit easier from your end because you've mentioned that you have a thick skin and you put yourself first. If you do not like this, well, you might as well walk out.
Yeah.
Now we have other people out there who are probably scared, even to make the first move. Now, not from your experience, but how do we help such, type of people?
Putting on the spot like this. Well, how we can be able to help that person is by giving them an opportunity to be themselves, to express themselves, to, talk about how they're feeling, provide a support system for them, create room for them to grow. Because in the end, that's all they need. That's all they need, an opportunity to be able to love again, to be in a space where they're not criticized, right? So even in workplaces where you don't have to feel conflicted when it comes to taking medication. So all we need is to provide the right support system. And oftentimes we might tend to seek a support system from our friends or family, and they might not be the right people to offer support system. But for people living with HIV, your first and nearest support system is your therapist. Every facility or most facility that I know of, for people living with HIV, once you go into the CCC, and that's a comprehensive care center, and you getting your medication, you can request to talk to someone. And they provide you, they give you that time to talk about how you're feeling, to guide you through your steps. They provide that stepping stone. That support system starts with them. Because if you don't ask for it, then, you're not going to get the right help that you need. There is no way I can be able to help you out if I don't know what you're going through. If I just go to the facility and take my medication and, if the doctor doesn't ask how I'm doing, then tell the doctor how you're doing. Tell the doctor, it's really hard for me to take my medication because I live in a violent relationship. It's really hard for me to take my medication because I'm still in high school and my parents don't know about it. Talk to your doctor about it, and they're going to be able to provide ways and steps you can be able to overcome that. You don't have to start thinking about which friend you're going to talk to. First, you need to start working with yourself, and your doctor or your therapist is going to be able to guide you through that. So everyone who's living with HIV has access to a facility, and that facility has a doctor. So you can talk to that doctor. Make your doctor your friend.
Yeah. And apart from just talking to your doctor and maybe a therapist, do we have other support groups or support systems that people can join?
I honestly have never been an advocate of support groups. I mean, I have done really well without support groups, but I don't know, but that's just me, right? Okay. But I do hear people do want support groups, and I try and connect them to support groups. Although with support groups, you really need to be very, very specific about the kind of support group you need. Because sometimes people just need to be in a support group to see which other people are living with HIV. Some others need to be in a support group just to, get the benefits of having a support group where people come and talk about their experiences. But nowadays, the support groups that I tried to join when I was living with HIV were all talking about, meeting up for drink alcohol or, gossiping about this person and this person. So I felt it was not needed for me. But there are really, really strong support groups that are there catering for people with HIV. So that's something that can be connected to. And I'm pretty sure that in all, if not most facilities, do have a support group for people living with HIV. Again, it all comes down to you and asking, is there a support group?
Yeah.
Because most facilities do have them. Most facilities, if not all, I can't speak general, but because I have no idea, but most facilities, if you ask them, do you have a support group for people living with HIV? They can be able to link you up to one.
Yeah.
Yeah.
And basically, this conversation is not something we can just wind up in one sitting. And here at BitsCast KE, basically what we do, we ensure we bring conversations that matter to young people.
Yeah.
Now, from your vast knowledge and experience, dealing with people.
Knowledge.
Is there something we are leaving out from this conversation in terms of, intersectionality between the queer people and HIV/AIDS?
Something we're leaving out.
that one thing you're like, I have to talk about this?
I would have to talk about how people always, this happened to both, the queer community and the general public in general. Damn, sounds so corny, but yeah, it would have to be, let's stop forcing people into acceptance, because that's where we go wrong. If I approach you as a friend and I tell you, Alex, I'm HIV positive, I don't expect you to say, Anihoma, we accept. Nah, that's not how we go about it. I came to you for support. The best way to ask is, how do you want me to support you? Exactly. Yeah. Not, we accept, it's normal, nikama homa. Nah, that doesn't make sense, right? That's stigmatizing me and pushing me down because I look to you for support. I haven't accepted it yet, but you're forcing me to accept. Acceptance, again, is a personal journey. The best thing you can be able to support me with is to ask me, how am I taking my medication? Because that's the first step. Taking the medication, that is the first step. Whether you're queer, whether you're straight, the first step is taking medication. And I promise you it gets easier with time. That's something I have come to. It gets easier with time. There are no hurdles that come towards it. We might look about accepting and all whatnot, but it gets easier with time. Let's not force acceptance, right? If it's a queer person, don't just start saying things like, because you choose to be a lesbian or you choose to be a transgender person, this is why you're HIV positive. Nah. What support does that person need at that time? That is what should be offered. That is exactly what you need to understand. How can you be able to support them? And if you don't know how, ask them how they need to be supported, because the support looks different for everyone. May just need someone to tell and that's it. Maybe it doesn't need someone to could you be able to be coming with me to the facility? Would you be able to help me when it comes to taking my drugs? So support is very different for everyone. You just need to ask, or you just need to tell the kind of support that you need, or the kind of support that you want.
So thank you so much for that. Maybe we would have left that out, and it is something that will help a lot of people. As we wind up this conversation, what are your parting shot? And I want you to dedicate this to, let's say, someone who is maybe just tested, HIV positive, and whether they're straight or a member of the queer community, just speak to that person. 1 minute of what do you call it? Of fame or something.
To you who just tested HIV positive, damn, life sucks, but it doesn't, right? And it does feel like that. It does feel like life sucks, and to a point, it's gonna get bad. It's gonna get so bad. But you just need to understand that, you're gonna pull through, right? Because I also thought that, damn, it's hit the fun. You know what I'm talking about when I say it's hit the fun. That's what I thought. But take one day at a time. Learn yourself better, because once you learn yourself better and you understand yourself better, it's gonna make things easier. I know I'm saying it's gonna be easier so many times, because matter of fact is that's what happens. It becomes easier as time. Every day you begin telling yourself it's just a pill that you take and your life moves forward. Nothing changes. Kama ulikuwa sherehe, unaendelea na sherehe. Kama you're meeting up with friends, you're gonna go ahead and meet with friends. Nothing changes. Just took your pill and that's it. So it becomes easier with time. It's hard now. It's gonna get so bad, but it's gonna get easier after that.
Thank you so much for that and for the entire conversation. But before I let you walk out, I understand that you also do a lot of content. So people can, run to your channels and all that. So give us where we can find you on social media. And maybe if you have a website or something, you can also
But my socials is Ruele Okeyo. That is RUELE _OKEYO, Ruele Okeyo, on all social media platforms. And my podcast is Sex Ed by Relations. It's on Spotify and all your streaming podcast sites. disclaimer, guys, disclaimer. When you come to my inbox, don't just start with hi. I don't respond to highs and hellos.
Whatever you're looking for.
Exactly. You do like, hi, this is this, I'm going through this and this. Could you please be able to provide guidance? I answer to those. But highs and hellos, nah. My relationship status, please, let's not talk about that, because that's a question I also get, like, are you dating, in a relationship? I'm also trying to find that relationship. But yeah, it doesn't happen like that. So just come and air out what you need assistance with, and I will try it to my level best, because guys, I am not a doctor. Yeah, people tend to forget that. I am not a doctor. I might not have all the answers. Okay, I will provide the answers to things that I know about. Yeah, but I'm not a doctor. So do understand sometimes if I do refer you back to your doctor, that's because that's a clinical matter. Thank you.
Yeah, thank you so much. That was Ruele Okeyo. We had an interesting conversation around the intersectionality between HIV/AIDS and the queer community. And we talked about stigma and a lot of things that the queer community and people living with HIV at large face. Thank you so much for joining this conversation. Until next time, keep it locked. BitsCast KE, conversations that matter to young people.
Mazungumzo ya kweli na jamii, uwezo kwa vijana, mabadiliko. Mazungumzo ya kweli na jamii, uwezo kwa vijana, mabadiliko.